has really worried us is this particular wave of the COVID virus is very different than the wave that we experienced in March and April. I know Nashville and Memphis both had experiences with that wave in March and April, which was very much the major metros of Tennessee and the surrounding bedroom communities. This spread, however, is equally across the state into rural areas, peri-urban areas, small cities, and of course your major metros. And that is what has been the most concerning to us, is to watch that broad spread across the state, very similar to what they experienced across our southern United States. That part of this epidemic started as primarily new positivity and new infections in our under 35-year-old age group. Many of them were asymptomatic and spread the virus unknowingly to others. And so by the time you were seeing the virus from that small tick up in test positivity, it was well distributed throughout many of these states. So in Louisiana today, almost all of their parishes are over 10% positive. The same way across Texas, Alabama, Mississippi, Florida, and Arizona. Tennessee stands at that very important moment in time where their test positivity has just increased into the greater than 10%, with multiple counties between 5 and 10% and several counties over 10% test positivity. And is this very moment where we can change the trajectory of the epidemic before it goes into full what we call logarithmic spread, as we've seen across the South. And so I really came to talk to the governor about how important it was for every rural Tennessean to wear a mask. It is in all of your rural counties. I know some of you find the mask uncomfortable, so do I. I put it on at 8 a.m. this morning. I haven't taken it off since. I do this out of respect for each one of you because I have been across the United States where there has been a lot of virus. And so every Tennessean today, in order to be able to get back to school, in order to ensure our businesses stay open, every Tennessean, whether you live in a rural area or an urban area, needs to wear a mask to protect your family, to protect your grandmother, your grandfather, your aunts, their uncles, who we know can have very serious consequences to this disease. And so it's calling on all Tennesseans to make that sacrifice for your family, for your children, so they can go back to school, to really wear a mask and protect each other. In fact, if you have been in vacation in a hotspot area across the South, really calling on all of you to protect the elderly. Don't go and visit them for the next 2 weeks. If you have someone in your house that has comorbidities, you should wear a mask inside and protect them also. We've done a lot of modeling, and we have found that if you all wear masks, all Tennesseans, in every public area, and you protect the individuals with comorbidities, if you stop going to bars, and indeed close the bars, and limit your indoor dining, that you can have, and we do social distance and wash your hands, that we can have as big an impact on decreasing new cases as what we had with sheltering in place. This is what's possible. We have our freedoms. We can go out. We can socially distance in specific restaurants and be distanced from one another and protect one another. And we can have SEC football if together we decrease the case numbers. And so Tennessee is at that inflection point. And we wanted to come here and talk to the governor and his staff and incredible Tennesseans that have led through so many other issues, and the mayor of Nashville to really appeal to every Tennessean to wear a mask, particularly rural mayors. If every rural mayor could mandate mask wearing, the virus is there. You may not see it today because it may still be in young people, but it's spreading, and it will hit your nursing homes, and it will hit those that have serious consequences to this virus. We know who those individuals are. People who have trouble with weight, people who have diabetes, people who have hypertension, people who have chronic lung, renal, and heart disease, We have many Tennesseans that suffer from those issues, and it's our moment in time to protect them. And we can change the future of this virus in this state today. We continue to social distance if every mayor throughout this great state would mandate masks, close the bars, and substantially increase indoor dining distancing. Together we can get through this.